All right, it's 10 o'clock. I'm going to get started. Good morning and welcome to our October AT Talk. I am Diane Dudash, the Director of Programs and Advocacy at MI-UCP. If you would like a sketch or a certificate of completion for this presentation, please email me. I have put my email address in the chat box. This morning's presenter is Michael Bray. Michael is an instructional designer, researcher, and data analyst that has worked in the developmental disability field since 2003. His primary area of interest lies in the design and implementation of inclusive, accessible learning environments that enable diverse adult learners to develop new skills and knowledge. Michael has been the MyLend training director since 2017. The MyLend program trains emerging leaders with the goal of improving the health of infants, children, and adolescents with or at risk for neurodevelopmental disabilities and other related healthcare needs. MyLend is a collaborative effort of 6 universities: Central Michigan, Michigan State, U of M Ann Arbor, U of M Dearborn, Western Michigan University, and Wayne State University as the lead organization. Welcome, Michael. They're all yours.
All right. Thank you, Diane. Thanks, everybody, for coming. I have to add one more university to that list, Northern Michigan University, which is my alma mater, so I'm a little biased in that respect. But thanks for that introduction. So what I'll talk about today, and I'm going to go ahead and share my presentation, is a project that I was lucky enough to work on in 2019 and 2020. It was a little outside of what I usually focused on at that point in the work that I was doing. As Diane mentioned, my primary focus, which continues today, is on instructional design and inclusive education, right? So creating online learning, creating classroom learning, curriculum that is inclusive and accessible is something that I'm very passionate about, and accessibility in general. So that when this project, I was speaking with my director, Sharon Milberger, and we were talking about, this was back in maybe 2017. We were reading a lot of articles and seeing a lot in the news about self-driving vehicles, especially when Tesla really hit. They have their autopilot mode, and we're like, wow, well, what is this going to look like in 5 years? Well, about close to 5 years later, it's looking like this technology is coming out all over the place. Okay, so we wanted to get out ahead of it a bit. We wanted to really focus in on how this technology, how autonomous vehicles, or AVs, I'm going to refer to them as AVs throughout the presentation.
Michael, can I bother you for 1 second? It's
sure.
Important, and I did notice there's a little distortion in your audio, so maybe, I don't know if you can.
Oh, really?
Yeah, can you adjust your microphone maybe slightly away from you? Or
is it? Oh, I'm talking too loud, probably. Sorry about that.
Yeah, it's hard to, it makes it a little tough to understand, so I just want to give you a chance.
Okay.
Okay.
Is this a little better? Does that sound okay?
Yes, that sounds good.
Okay. Yeah, I tend to speak pretty loudly. Sorry about that. So we wanted to get out ahead of it and really focus in on how this technology could potentially impact individuals with different disabilities, whether those are physical disabilities, intellectual and developmental disabilities, and how we can make sure that the voices and the ideas and the needs of our community is being met by those who are designing the vehicles, those who are setting policies at the state and national levels. So we proposed a project, and it was funded by the Michigan Developmental Disabilities Council. There was a round of grants coming out at that time, and we thought, this would be a cool project to really, a cool topic, and an important topic to really look into. And so we were funded by the DD Council. Hopefully, most folks here today know about the DD Council. So just backtracking a second, so my DDI, or the Michigan Developmental Disabilities Institute, where I work, is part of a statewide disability network, and every state has one of us. So we're the university center. We connect university research and the work going on campuses in higher education to the community and provide training and technical assistance. The other two members are the Michigan Developmental Disabilities Council. The DD Council oversees most of the activity going on in the state around developmental disabilities. And then the third leg of that tripod is the Disability Rights Michigan, or used to be Michigan Protection and Advocacy. I already forgot, and they just renamed themselves to Disability Rights Michigan, and they really focus on the law and policy and so on. So we're part of that network, so we all collaborate whenever possible. Oh, and I should mention too, if you have questions as I'm going along, please feel free to post them in the chat, and we'll address them as we go. So the project had three goals. The first was really to evaluate the potential for both positive and negative impact of AVs, of the self-driving technology, on those who are going to use it that have disabilities in their families. Like, we wanted to get a better understanding of, what could be the dream, what could be the most positive way that this technology could affect individuals. And then also, where could there be pitfalls? What are some of the potential negative aspects of this technology if it's not addressed before it hits the road? The second goal was to really determine how this technology should be delivered in a way that is inclusive. How can we make sure, or at least affect the way autonomous vehicles, AVs, are put on the road in a way that makes them not just another barrier to transportation for individuals with disabilities. As many of you know, and as I'll talk about a bit in the research that we did, transportation has always been and still is a big determinant of a person's inclusion in their community, it impacts their health, their ability to get to doctor's appointments, it impacts people's ability just to go to the grocery store, right, and to live independently and self-determined. So, it's not something that's going away, and it's something that we've been trying to help address for many years. The third goal of this project was to really develop recommendations. So we were going to take what we learned and then apply that to some recommendations for those making policy and laws in Lansing and the national level, transportation authorities, so county transportation, local transportation authorities, and then those building the vehicles. So, you have the big three: GM, Ford, Chrysler. You also have smaller companies who are making autonomous shuttles and vehicles, like May Mobility out of Ann Arbor. So we wanted to put forth some recommendations that we learned from those who will be directly affected, and make sure that their voices are being heard by all of these people as this technology is being researched, developed, and put on the road. So to achieve those goals, we had a mix of different methods that we wanted to use. Participatory action research. It's hard to understand what that is, even for me, because it's something you don't hear about a lot. But all that means is it's the type of research that involves the folks who are going to be directly affected by what you're researching. So, and that's something that my DDI has always done. It's a core principle of ours to involve stakeholders, to involve individuals with lived experiences in the research that we do, in all of the activities that we do. So we wanted to make sure that those who are being directly affected are going to be involved in telling us about it and involved in the research directly. And we collected what's known as qualitative data. So there's generally two types of data that people talk about: quantitative and qualitative. Quantitative being the hard numbers. When you're most clinical research, you're collecting, impact of some intervention on quality of life, and you're measuring it in some way. Qualitative data, best example is collecting data through focus groups. So talking to people, getting their stories, speaking directly with stakeholders, and really gauging and collecting data from them. The third type of research that was part of this project was something called a Delphi panel, and I'll talk more about that in a bit. But a Delphi panel is essentially, it's a panel of experts, and these experts are from many different fields and have many different lived experiences. And it was my first time doing research with a Delphi panel, and it was pretty interesting. But again, I'll circle back around to that in a bit. Yeah, so doing all this together, we wanted to ensure that that the research and the outcomes of this project were really directly serving individuals with disabilities, their families, and those who are going to be directly affected by the introduction of self-driving technology. So first thing I did, and luckily we did this in 2019, so right before the pandemic, we wrapped up our focus groups. So the timing of this it couldn't have been better. We were very lucky to be able to complete this. So we did 8 focus groups around the state because we wanted to really get a mix of people from different backgrounds, different areas, those living in both rural and urban, big cities, small towns, because transportation can look very different in those different environments. We also wanted to get as good of a representation of people's backgrounds and cultures and needs as we could. The goal is always to really represent the population, represent the people that you are looking to apply your research to. And in this case, we were really focusing on Michigan. So we really tried to get a good mix of folks from around the state, which I think we did. It was really interesting. And I love doing focus groups. I just love talking to people. So whenever I get a chance to go and talk to folks directly, I take it. So we asked participants of the focus groups a few different things. We wanted to talk about their current transportation. What are their experiences? How could it be better? What barriers were folks facing? And what was working? We always, with transportation and the disability community, it tends to really always go to a negative space because there are a lot of barriers and then there's a lot of things, especially with public transportation, that really need to be addressed. But we also wanted to find out, hey, what's working? How do you get around? What parts of your transportation are can we talk about that are good? We also then wanted to know about what they knew about AVs. A lot of folks had heard of Tesla in the self-driving mode in Tesla vehicles. We really wanted to know what folks' experience level, what their knowledge levels were about self-driving technology. And then really, what are their hopes and fears? What's their hope for that technology? What are their concerns? What do we want to address? So basically, if you could talk to, someone from GM who's working directly on accessible vehicles and working on accessibility, what would you tell them? How should the vehicle be made to be accessible, fully accessible for you? So that was important because we wanted to really talk to folks that had all different types of disabilities, because accessibility really means something different to each of us, right? So what I find accessible may not be accessible to my wife or my daughters, right? So we wanted to get as wide of a variety of input as we could. And then just other ideas and comments, around transportation. We really, when I do focus groups, we try to keep it structured in a way that I'm asking the same questions across all the focus groups, but I also want to have a conversation. I think it's really important to engage folks in conversation because then you really get to kind of the core of what people are thinking. And in this case, really wanted their ideas and their comments. With some really interesting ideas about how vehicles could be made accessible, most of all, people wanted to buy one. They're like, where can I buy one? I'm like, well, hopefully soon you'll be able to you could own one in your garage, right? And we talked about that versus the potential for autonomous public transportation, so self-driving buses and shuttles, which are already on the road in some communities. So some really interesting conversations. And from those conversations, we had a few themes emerge. So current transportation options were all over the board. So family members, when I asked, how do you get around? A lot of folks said their family members drive them. Some folks drove themselves that were able to. Direct support professionals, so different direct care workers, aides, were a primary means of transportation for a lot of folks. And that was seen especially in smaller towns and more rural areas. Service providers, right? Private and public door-to-door services. So those can be, for example, I know in Flint, oh shoot, I forgot the name, but I think in Flint it's called Your Ride. At least it used to be. And that'll come, you call and schedule, they'll come right to where you are and bring you to where you need to be and then back home. And that includes paratransit as well. So buses, shuttles, vans with wheelchair lifts, for example. And then also we talk, people use public buses and shuttles. Other themes, we talked about barriers. So one of the bigger barriers was the scheduling and availability of transportation. And this was all over. This was in bigger cities like Detroit, Escanaba, smaller towns like Escanaba, Iron Mountain, and all over the state. The scheduling, the way people would schedule transportation looked different. However, I heard a lot about it being very difficult to do. And then the availability, and even back then in 2019, and I can only imagine now that the schedules of availability for different types of transportation were very narrow windows. So sometimes transportation wouldn't even be available on a Sunday, for example, or very limited on different days of the week. And I have heard lately too that's shrunk even more with a lack of bus drivers, for example. So the schedules have shrunk, which in turn really is a major barrier to folks just getting around in their community, going to the grocery store, going to church, going to doctor's appointments. So that was a big one. And I heard that, I want to say at every focus group we had, that was something that was mentioned. Yeah, so like I said, it negatively affects relationships. You can't be spontaneous if you have to schedule out 2 weeks in advance to go grocery shopping, right? And I heard that was something that was mentioned specifically in multiple focus groups. So it's not just one location. More themes. People are excited about autonomous options, as they should be. I am too. It's an exciting prospect to think, oh, I can just get in the car, read a book, and it'll take me to where I need to be and then bring me home later, without having to rely on someone else. It's a pretty exciting type of technology. But there were still concerns about how the vehicles would be offered to the public, or where are they going to be expensive to use? If for example, if AVs are used by, say, Uber, and you can go on the Uber app and ask for a self-driving vehicle to pick you up, is that going to be more expensive? If you want to own one of these vehicles yourself, I mean, what are the maintenance costs? How much are they to purchase? There's a lot of concern about that, as there should be. So we want to make sure that this doesn't become a financial barrier for folks to use this technology when it's available. And then will there be more paratransit AV options, right? So are there going to be more shuttles, more autonomous buses that have wheelchair lifts or other accessibility options that are built into it? And the biggest theme to occur was independence. Folks are very excited because a self-driving car can really offer someone independence, complete independence. You don't need to call someone for a ride. You don't need to schedule 2-3 weeks out to go to the grocery store. You can be spontaneous. And that was a big theme. People want to, you know, like anyone else, anyone should be able to be spontaneous and say, oh, I'm going to go, you know, visit my brother today or my sister today, and just jump in your car and go, you know. And many folks that have disabilities cannot do that. So that's a big hope and big dream for a lot of folks, is that they can be independent and spontaneous. There were a couple of people at our focus group in Midland that were excited to say, well, I just want to get in and go to California. I'm like, that would be awesome. that would be really cool. So yeah, there's a lot of big hopes around this technology. Another one must be safe to use, of course. Like any other vehicle, you know, how we heard from some parents and some family members that were part of the focus groups that they're concerned, well, how will my son or daughter, if the vehicle gets in an accident or if it breaks down, how are they going, you know, what will they do? You know, so there's a lot of concerns about safety, which, you know, of course, with any type of transportation, safety has to be, you know, at the top of the list. Cost and maintenance, kind of mentioned that already. How could these vehicles affect? So connection to the community is an interesting one. Some folks are excited because if they had access to a self-driving vehicle that could bring them anywhere in the community at any time, they felt, oh, I'll be more connected, I'll be more included in my community. There were a couple people that were concerned that if, say, the city bus became a self-driving vehicle, like they offered in their community, city buses and shuttles were autonomous. Well, they were friends. These people were really good friends with their bus driver. And they would see them every day because they used that bus every day to go to work or to just go out in the community. So it was an interesting point. How would it affect those relationships? You know, is there going to be someone of authority on these buses? Someone from, say, the city transportation office? Will there be someone like a porter, someone who rides along on the bus to assist people? I don't know. I don't know how that's going to look. So it's a really interesting point. And again, you know, the whole point of this, they must be accessible for all users, which is one of the main focuses of this study. Well, pause here for a sec, see if there's any questions. I don't know, Tracy or Dan, if there's any questions that have come up in the chat.
I am watching, and no, we don't have any yet, so I'm sure they're coming. Okay.
All right, I will continue. So after the focus groups were done, we put together what's something called a Delphi Panel. And a Delphi Panel basically is a panel of experts. And what our goal was to take the information that we learned from our focus groups and then use that to develop a survey around all the different topics that the focus groups brought up. And that survey then would be sent to this panel of experts to weigh in on, to add their expertise to that information. So we assembled a group of 10 people. They were from all different fields and experiences. Yeah, that. We had folks from engineering, computer science, we had self-advocates, family members, people from law and policy making, people from public transportation offices. We had some folks from autonomous vehicle development, in particular, individual from May Mobility, and they make. So you'll see in the picture here, there's a picture of 3 red, green, and blue. These are self-driving shuttles. And these are examples. These aren't from May Mobility, but May Mobility makes these small self-driving shuttles. If you live in the Grand Rapids area, I know they've been operating in Grand Rapids for a while now. They can take you to different parts of town. So we had folks from that company. Social service industry, we had some social workers on there, and disability advocates. So we had a really nice mix of folks with different types of technical expertise, different types of lived experiences, and they really offered some insight into this. So what did they do? So they completed a survey. So like I said, we used the focus group information to develop a survey, and there were 70 items. It was a pretty big survey. And we did this in early 2020. Luckily, we had already planned to do all this virtually. The survey was an online survey. And so luckily with the onset of the pandemic, we were still able to really get this done. And we're very lucky. So the group was sent the survey, and the survey items really asked, so a Delphi panel is looking for agreement. We have these 10 experts and we present them with an item like, autonomous vehicles should be made accessible for individuals with all types of disabilities. And we asked them, do you think this should be a topic that is focused upon by automakers, by policymakers, by those that work in public transportation? So we asked them, yes.
Good question.
Sure.
Based on the study, what do you anticipate the timeline will be that AVs will be available for regular use for people with disabilities as a transit option? 5 years, 10 years, 20 years? And then the next one came right up. And what would be the cost of them? The cost,
yeah. The cost is a big question. That one, it's hard to say. It really depends on what we're talking about. So if it's public transportation, the cost to use them, I don't think at this point, it doesn't look like it's going to go way up, right? As long as, for example, if there are autonomous shuttles operating in some communities already, and some of them are free because they're using them as kind of research right now to see who can use them, who's going to use them, how often would people use them, right? So those are kind of free, but there are some autonomous buses and shuttles that are moving, and I don't believe the cost has really gone up for those. So for public use, I don't believe the cost has gone up yet, and I'm hoping that'll continue. That's really going to come down to how these vehicles are rolled out, how they're presented, to the communities. So, for example, if Oakland County, where I live, if they decide, we're going to have 5 self-driving shuttles that are going to run in the community. How much did they pay for them? Were they donated? What's the cost of maintenance for these? Is it any more or less than, say, a regular bus or shuttle with a driver? So those are a lot of factors, and the cost has been one where we've really had a hard time nailing that down. That'll come out in the next few years. And to address the first question, will they be available 5, 10, 20? They're available now. They're not as widespread as your standard vehicles are. But self-driving, autonomous buses, shuttles, even Uber and Lyft are starting to roll out self-driving vehicles in their fleets. I would say in the next 5 years, you're going to see quite a few more of those available. I think sooner than later, for sure. And especially with the race towards all electric vehicles, the electric vehicle platform tends to lend itself more easily to the self-driving autonomous type of vehicle. So I think especially the big 3 automakers, and you can throw Volkswagen in there as well, more and more of these electric vehicles are coming out, and more of those electric vehicles are going to have a self-driving option, if not totally autonomous. So I would say definitely less than 10 years. I would say you'll see far more of these on the road in Michigan in 5 years. Yeah, great questions. And a lot of this we really don't know yet. It really comes down to, how much money are these automakers putting into these vehicles? Because if they're putting in a ton of money, then the cost to own your own may be higher. It all depends on the technology, which I wish I could predict that. The cost of the technology being used is really going to factor into how much it would cost for, say, you and I to go out and buy one, and buy like there's already some that have like autopilot, right? Tesla's the big one, and we all know about that. But more and more of our other automakers are putting out these vehicles that have that option. So it's slow. It has been slow, but I think in the next few years it's really going to accelerate. So I would say keep an eye out for it and really look in your communities, especially with the public transportation. I think you're going to see a lot more going on there. Great questions.
Oh, good. I have one more.
Oh yeah, do it. Go for it.
Being outdoors is becoming more topical and popular as we see the benefits. Will AVs be able to navigate rural areas in a reliable manner? To get to a family cabin, state park, or campground that is accessible, do you see the technology being able to map areas like this in an accurate way? From what you've seen so far, is that encouraging?
It is, yeah. So the technology. So at Wayne State, actually, there's a really big initiative around mobility that is really gearing. There's a lot of work being done within the computer science and engineering departments, and I've seen. So there's a car lab right a block from our office in Detroit that I was able to go check out, and the technology that they are using is so far, it's so advanced that I really hard time understanding it, to be honest. The different types of LiDAR and radar that are used. And then as far as mapping to different places, yeah, I mean, they use GPS. So you could technically tell the car to go anywhere. And it really depends on the GPS being used by a vehicle and the completeness of the maps that a vehicle is using. So I would say, if it's on the map in Michigan, this type of vehicle would be able to bring you there. There will be barriers if it's a really bad road. It really depends on the type of vehicle to get you, like anything else. If it's a 4x4 or if it's a really small compact car, that'll make a difference. But yeah, I mean, from what I've seen, these will be able to bring you anywhere, and it's really going to depend. Whether or not it can get to a place is going to depend on the type of vehicle and the ruggedness of where you're going, honestly. So, when I go up to my hunting camp, I need to have my truck because I can't get back to where I need to unless I have a four-wheel drive vehicle. So same thing will apply, Great question. All right, so just a little bit more about the Delphi panel and what they did. So again, we posed these questions to them in the survey based on what the focus groups told us. And we asked this group of 10 experts, what do you think? Should this be something that is a primary focus of these different people, of automakers, policymakers, and public transit authorities? So we had them go through different items on it. They completed it online. And like I mentioned, the survey was made using the information we collected from the focus groups. So what was important to people with disabilities and family members was what the survey was, what was used to build this survey that was then sent to these Delphi panel members. Extra slide in there. So, and the goal here was to ensure that the needs of individuals with disabilities and family members are front and center. We want that at the head of the conversation, right? It's not something that we don't want it to be an afterthought. We want these needs that, from my background, when I'm designing, say, a course or a training, you don't want to bury the lead, like they say. You want the purpose, you want everything, the accessibility to be right at the beginning. You want to build a course that's accessible from the start and not have to go back after it's done and then retrofit and make it accessible, right? Because it's never going to be as effective or accessible as it could be if you did it from the beginning, right? So we want to make sure that for individuals with disabilities, family members, others in the disability community are included in the planning, the design, and the testing of these vehicles. And then also included in setting the policies at the local and state levels to make sure that these vehicles are available and accessible. So that was the point of the panel. So they completed the survey, and we used some different criteria, which I'll mention here in a second. to see whether or not they came to an agreement on it. So the point of the Delphi panel is to find agreement. We want this group to agree that this idea is important, this one's not, or this factor is, this should be focused on, this really doesn't need to be focused on. There were a few items that in the first survey didn't reach agreement. So people were split whether or not they thought, this topic was important. Some thought it was, some didn't feel it was. So then a second survey was sent with just those items. I think there were only 6 out of the 70. There were only 6 that the group didn't really agree upon. So we sent it again with more information, said, hey, maybe consider this, because the perspective of, say, an engineer might be very different, is very different in a lot of ways than the perspective of someone with cerebral palsy or someone with an intellectual disability. So we tried to make sure that the engineers and the individual disabilities had information from both sides to maybe reconsider the topic, So it was an interesting process. Like I said, this was my first time going through this Delphi panel process. And the survey items were organized under 5 different categories. So these categories came from the focus groups. One was items around current transportation barriers and how they can be addressed. The other was the other potential positive and negative impact of AVs on individuals with disabilities. And then we looked at what needs to be done to make public AVs accessible, buses and shuttles, versus what needs to be done to make personal AVs, privately owned cars, or cars that are used by rideshare companies like Uber and Lyft. What needs to be done to make sure those are accessible to the widest range of people possible. And how we defined group consensus. So how did we know if the Delphi panel agreed on an item? Well, there's past research that we used, and we wanted 80%, so 8 out of 10. If they chose the item to be either a high or a top priority, then that item was carried forward. And we also used that to look at items that were considered low or no priority. And there were some that the group was unanimous, no, this isn't something that, should really be focused on in this space. And so we use that. And also they need to be low in variance. And that means the group needs to be mainly in agreement. So if you had 5 people that thought this should be a high priority and 5 that thought it should be a low priority, then you'd have a lot of variance across their answers, right? We wanted folks to be in agreement as much as possible. And not all items were agreed upon, and those were set aside for future discussion. So the result of all of this was a white paper. And a white paper is just essentially a research paper. And in this case, it was written to describe the project, but more importantly, the outcomes, because we were really looking to make recommendations around autonomous vehicles and accessibility based on what we learned from the focus groups and the Delphi panel, right? So we wanted action items. We wanted something that we could write up, send off to policymakers, something we could send to engineers and those that are working on developing this technology and say, hey, this is what we heard. This is what folks with disabilities, family members, other experts in the field, this is what they told us. And this is what we recommend you take into consideration as you're developing these things, whether that's developing the vehicles themselves or developing the policies around them, putting those vehicles on the road. Just wanted to increase awareness of the transportation, continue to increase awareness around the transportation needs of individuals with disabilities in Michigan in particular. So it's a very Michigan-focused project and paper, although from what I've seen at the national level in different presentations, it's the same concerns and the same items are being focused on nationally as well. So that was actually pretty reassuring that what we're experiencing in Michigan is something that is going on around the country. So it makes it even that much more relevant, really. And we wanted to highlight the importance of including persons with lived experiences in the design and the development of this technology. It's what is it? Nothing about us without us, right? So if you're developing this technology and you're trying to make it accessible, well, let's make sure that there's a wide range of individuals with accessibility needs that are involved in the design, that are involved in developing it. Because if you don't have folks testing it, how do you know? You know, and that was a big one. That was a big one we heard actually from engineers as well. They really want to connect with the disability community to get that input to make sure that what they're doing is going to meet the needs of because they really want this technology to be used by everyone, right? So they were excited to, you know, a couple of the engineers that I've sent this paper to were very excited to see those recommendations. So we ended up with 10 recommendations. Again, they're all based on outcomes of the project, what we heard from the focus groups and the Delphi panel. And we really wanted it to be a call for action to ensure that folks with disabilities, their needs, their ideas, their hopes and concerns were all, you know, part of the process as this technology is ramping up. So I have them on the following slides. I wasn't going to go through all 10, but they're in there. And I know that the slide deck here is available to everyone, so you can look through it. And I'll show you a link to our webpage that has a link to the white paper itself if you want to download it. And I think there's some questions, right, Tracy?
Yeah, there are.
Sure.
The first one is, was there anything research done regarding freeway driving? That's the first one.
Okay. Yeah, I know there has been. I'm not sure of the outcomes of that, but I do know that the majority of testing that's been going on. So there's been an autonomous, I know Ford has had autonomous vehicles driving around the streets of Detroit now for 8 or 9 years. And, you know, and on the West Coast, Google has been developing autonomous vehicles for a long time, for at least 10 years now. And they've been driving around on the freeways and county roads and everywhere out on the West Coast for that long. And I know the incidences of actual accidents are extremely low, very, very, very few. So they at this point, from the research and the testing that they've done, the self-driving autonomous vehicles are very, very safe. So I hope that answers the question. But yeah, they've been testing that for quite a long time, and I know they're on the freeways. Actually, saw it on the freeway. It was a couple years ago, because the cars they're testing now, you'll see they have a big dome on the top in a lot of cases, or a big setup that sits on top of the car that has all the radar and everything, and the LiDAR. So that's, you know, I've watched them, and there's a guy sitting there. There were 2 people in the vehicle on laptops. They weren't even paying attention. So it was really interesting.
One of the questions, I don't really understand the question, and I asked for clarification, but I haven't gotten it. But they're asking how many miles per gallon to electric. So I don't really.
Oh, I don't know. I know that the range of electric vehicles has been increasing quite a bit in the last couple of years. Just with the research and development around batteries, that's the big one. So I'm not sure. I know that as far as self-driving, I'm not sure, but electric vehicles in general, I mean, they're getting up there now. Some have 200 or 300 mile ranges, or even more. So, and I know that's going to keep increasing, because that's a big focus, I know, of those developing electric vehicles, is the range, right? You want to be able to drive. I want to be able to drive from here to Marquette. I'm in Oxford. I'm just north of Detroit. So from here to Marquette is typically 6.5, 7 hours. You know, it would be nice to be able to drive there on one charge, but I'm not sure. I don't know if they're capable yet.
And I think this comment was in direct relation to something you said, but it says, and safe for everyone. So they're talking, I guess, about safety related to something along the way.
Yeah.
And then someone comments, this is great information. We have 2 teens who are not ready to drive, but we're having conversations around alternative transportation solutions.
Yeah, I'm right there with you. I have one teen who's in driver, who is her permit, and the other one just turned 13, so it's coming. And I would love. I mean, I love driving still, but you know, when you think about your kid, and it's funny because we had one focus group in Grand Rapids that turned out to be all parents, And the number one topic of discussion in that group was safety, and how safe will these vehicles be, you know? So yeah, no, they're very safe, from the data that's available now, as far as avoiding, because there's no human error, right? The only human error that would come into play there would be if someone in another car veered into it, right? And I don't think there's any way you can account for that, right? Because that's how sometimes it happens. But other than that, all the human error is taken out with an autonomous vehicle. So from that standpoint, the vehicle itself is extraordinarily safe. But yeah, I mean, it's always going to be a concern, especially if you live in a city like Detroit and you're driving on these highways. I still, even after commuting 40 miles or 90 miles a day for 10 years, I've seen so many just things that just make your skin crawl on the highways, that it's always going to be a concern. I don't think it's ever going to be 100% safe, but compared to human driving, it is proving to be much safer. Yeah.
And then another comment, fantastic information, Michael.
Oh, thank you. Thank you. Yeah, it's exciting. Very exciting. Oh, let me go back down here. Yeah, so like I said, there are 10 recommendations in the paper, and I'll show you the website and a way to you can download just the recommendations, or you can download and read the entire paper. And they're in the slides here for you. They're not in any particular order. They're labeled 1 through 10, but 1 is not more important than 10, okay? So I'll comment on a couple here. So one of the recommendations was the focus advocacy efforts on current scheduling practices, right? That was a big one that we heard about. How can the current scheduling practices for individuals with disabilities that are using, say, public transit or door-to-door transportation services, how can they realistically use existing public transportation in their community? If I have to go on, and I have a good friend of mine who has to do this, and he has to use the wheelchair, and he has to schedule his transportation 2 weeks in advance. So he has to know when he needs to go grocery shopping. He has to know when he needs to go anywhere. Well, it's just not practical. And then on top of that, if he's a couple minutes late getting to where he needs to be picked up, which happens especially in the wintertime, they leave, and then he's on probation and can't use that service for 2 weeks. It's just not practical, and it penalizes. It really, at the end of the day, people are being penalized for having a disability in a lot of ways. Now, this doesn't happen all the time, and I'm sure it's not all transportation companies, but I've heard too many stories for it to be an isolated incident. So that's a big one, right? So how can we address these things now, these scheduling practices and policies, before these autonomous vehicles hit the road, right? In a big way, before they're regularly available, I should say. Another recommendation was really to look at so I saw there's so many pockets of research and development and work being done around Michigan, specifically on autonomous vehicles. It's all over the place. Wayne State's doing it, University of Michigan, Western. There's private companies up north that are doing it, that are really starting to develop autonomous vehicles and how that's going to look. So really bringing all these people together to address the transportation needs of folks with disabilities is important, and to do it in both rural and urban settings, I think, is going to be key, because it looks very different. So the folks I talked to from where I grew up near Escanaba and Iron Mountain, the majority of people, their transportation are family members. Whereas when I was talking to folks in Flint, the majority of their transportation needs are met by either their direct support professionals, or most of them, it was the county or local transportation companies, the Your Ride, that would bring them around. So the needs are different, and that needs to be taken into consideration. I'll touch on one more here, and then I'll move on, because I only have 1 or 2 slides at the end, and then we can wrap up with the questions.
Okay.
if that's all right. So engage folks with disabilities, service providers, employment specialists, advocates, state legislators, all the above, to really look at solutions around the lack of direct support professionals. And now this is something that's been going on for years. Really trying to attract people to the field to work as direct care workers. Because we found out that they are a big source of transportation for the folks they take care of. In a lot of cases, they're the only source of transportation for folks. I spoke with a couple gentlemen that live together, not a group home. There are roommates, and there's four gentlemen that live in a house together. And the only way they get around is being driven by their direct care workers, their direct support, their DSPs that work with them. And when they don't have a DSP that's available, they can't go anywhere. So it's a big issue. It's a really big issue, especially now when employment and finding folks to work, especially in this field, it's proving very, very difficult. So. And I'll let you go through the rest. Like I said, I'm going to show you here in a second. Let me get down to the last couple slides. So you can go to ddi.wayne.edu/AV. I can post that in the chat as well for you. And you can find the paper there. You can find you can download just the 10 recommendations as its own document, or you can scan this QR code as well to get there on your phone or tablet. But yeah, so all the recommendations are in there. Everything I just talked about is written up in that paper. And if you ever have questions, my information's on that webpage as well. So you can, and I'm going to scoot ahead here. I do have the QR code on the very last slide that I can leave up. So questions or comments. Yeah, that's what I have. So are there other questions, Tracy?
Let me roll back a second here.
Sure.
So let's see. Since I did that, all right. So hope to hear results after further research. I'm so glad this research is taking place.
Yeah, me too.
And then to go where I want to go, when I want to go, on the feelings.
Yeah, yeah.
Yeah, pretty.
That's
exciting.
a big one. That's a big one. Yeah, yeah. I mean, it's impossible to be spontaneous if you have to schedule your ride even a few days in advance. Let alone a couple weeks. So yeah, I hear you.
And some time ago, my car died, and I was trying to get to work, and I had to go. You had to go in advance and prove you had a disability in order to use. Like,
right.
I couldn't schedule it over the phone without going to their office. And I'm like, if I had transportation to come to your office, I wouldn't need you to pick me up. That's
yeah.
Okay. And another one says the buy-in from the big three and VW is great. So many transportation issues over the years have stalled without their support. Is there a competitive factor?
Oh, definitely. Yeah. In fact, so just recently I've been talking with an individual from GM who is apparently has been made the head of accessibility for her engineering group. And so we may be working together and consulting with them, which would be fantastic. They really want to connect with folks with different types of disabilities. And to hear that was great, because that was the whole point of this project, honestly. But yes, there's definitely competition, especially for the electric vehicles, and that's spilling over into autonomous vehicles. There's a race. They want to be first. I mean, they want to be the one that has, well, case in point, if you look at the Ford F-150 that's coming out, the all electric, that's huge. The race to have the first affordable, available, fully electric truck has been a huge competition. And they're all trying to get it. There's private companies trying to get that on the road. So yeah, and I think that competition is definitely spilling over into autonomous vehicles, because we're seeing a lot more these standalone companies that are creating autonomous shuttles and putting them on the road. I mean, Ann Arbor has them. I know they're in Grand Rapids. So there's one other one too. There's a fully autonomous shuttle that has been running in Detroit around where the hospitals are, right in Midtown Detroit, and they're testing it on and it's being used by aging individuals and folks with disabilities that live in that area, and the shuttle brings them to their doctor's appointments at the hospital. So they're testing that. So there's definitely a lot of competition. They all want to be first, which is great. Hey, whatever it takes for them to get there.
There's a lot of appreciation here for the information, and
good.
So many people miss out because of lack of transportation options. This is truly hopeful.
Yeah, I hope it is. And you're right. I mean, when we talk about, in a lot of the work I do with our LEND program, we talk about social determinants of health, and transportation is a huge one. It has such an impact. I mean, there's one study that came out, 7-8 years ago that was showing that folks that didn't have access to transportation were dying younger because they weren't getting to their preventative care appointments. They weren't getting to regular doctor's appointments. And when you factor in, and these were called transportation disadvantaged communities, and a big part of those groups were folks with disabilities or parents of children with disabilities. They just weren't able to get to doctor's appointments either at all or on time. So it's a big issue. And hopefully, this technology will go a long way to bridging the gap there. It would be wonderful. I'm hopeful. I really think it will.
Yes, so. Lovely. Well, anything else, Michael, before you wrap up?
No, I think that's it from me.
Okay. Well, we wanted to tell you thank you so much for providing this update and information, and we look forward to having you back to talk about what's next.
Oh, sure.
In the whole realm. So I'm going to talk a little bit for a moment about next month. Douglas Tibbs told me that the life you save may be yours or that of a loved one in describing disaster preparedness. He became interested in emergency preparedness when he attended his first workshop after Hurricane Sandy. Learn about survival skills when an emergency arises, basic skills and items that may be used in preparing a disaster kit. Mr. Tibbs is a retired special education teacher. He's the owner of You Too Can Learn. He studied special education and therapeutic recreation. He continues to present nationally and locally, focusing on assistive technology, home modification, education, and emergency preparedness and adaptive sports. He designs low-tech items that are used for communication, and he holds a copyright on specialty paper for writing and math. I'm looking forward to and ask you to please join us a week after Veterans Day, so 1 week behind our normal schedule, to learn about emergency preparedness on November 18th at 10:00 a.m. So thank you all for participating. We appreciate all the questions. And Michael, it was just fascinating. Thank you again. And everyone, please join us. Thank you.
Thank you. Appreciate it. Take care.
Bye, everyone.